Cathryn Donaldson joins us this morning. She's a spokesperson for America's Health Insurance Plans, and she's with us here on WSBA. Good morning, Cathryn. How are you?
Good morning, Gary. I'm doing well. How are you?
We're doing very well today. Thank you for asking. Trying to work our way through, Friday the 13th, but we're not superstitious here, so we're not really worried about any of that, although we have a bunch of ladders sitting outside next to our building, so we won't be going underneath those. But anyway, when it comes to health insurance plans, you don't want to just have luck. You want to have a little bit of planning and figuring out what some of the things are that, kind of make up good health insurance. And your particular group, America's Health Insurance Plans, and your members are attempting to reduce the cost of health insurance. Tell us a little bit about how you're doing that through social determinants.
Absolutely. So you're right on that it's not just about luck; it's about preparation. So one thing I want to highlight here: social determinants of health. What is that? And I think it's really about a person's health being linked just as strongly to their genetic code as their zip code. So it makes common sense for the health insurance and the healthcare industry to really embrace these non-medical factors that are impacting someone's health. So that includes things like housing, food insecurity, financial insecurity, unsafe neighborhoods, and then things like transportation. So all of that, where you live, can really make a difference in your health care. So the health insurance industry is really focusing on these social barriers and how we can develop programs to address those.
I was watching last night the Democratic debate, and they were talking a lot about health care last night and how best to provide health care. And they were talking about Medicare for all, and some were talking about private health care plans and so forth. When you deal with any health care plan, though, you're saying there's a lot more that goes into it instead of, like the healthy foods that you eat, affordable housing. You mentioned a moment ago, safe and affordable housing. Other things like good health means social needs, meeting social needs. All these on your website at ahip.org. So, tell people a little bit about, how you have to take that kind of broad look when you're looking at providing health care as a society.
Absolutely. So when you think about someone's health, it's not just the medical and physical piece of it. It's not just going to the doctor when you're not feeling well. It's thinking about what's impacting your life day to day. So when health insurers are investing in social determinants of health, investing in tackling the barriers to health care, that's really a win-win across the board for communities, for patients, and for the entire industry. So I'll give you an example. If someone is suffering from asthma, they're on several different medications, and they're trying to address that condition, it makes a lot of sense to go into the home and say, okay, what are the allergens here that are affecting someone's health? Can we put in an air conditioner? Can we get some different types of couches or beds that may be contributing to those allergies and that asthma, and really addressing it at the source? So it goes way beyond just medical care, and we really need to look at the whole person in order to have that comprehensive approach to health care.
Now, the bottom line is that insurance companies are not just waiting for people to get sick and pay the bill, but are trying to keep people healthy. So what we're talking about here is really a proactive approach, a preventative approach, if you will, before you get to that point where you really are piling up the big bucks on healthcare, right?
Absolutely. So I think you're right on. It's more than just providing that high-quality clinical care. It's really about promoting wellness. So do our members live close to grocery stores where they can purchase fruits, like fresh fruits and vegetables? Does a child who's diagnosed with asthma, are they living in a building where there's mold? Does someone with diabetes have the ability to properly store their insulin? So that investment, that proactive investment on the forefront, is really going to make a difference and not only keep patients well, but keep them out of the hospital and drive down costs.
Yeah, and exactly. Your group is trying to provide various things, like even getting people transportation for doctor visits, right?
Absolutely. Transportation. They're even helping with housing and rent if someone does not have a secure housing situation. Geisinger Health Plan in Pennsylvania is helping patients with type 2 diabetes get access to healthy food and have access to diabetes education, dietitians, registered nurses. So, when you think about individual health, every single person is different, right? So you have to look at that person holistically and comprehensively to effectively address their health care as a whole.
I know one of the things my mother did when she was alive was the Medicare Advantage plans that offered free gym memberships to their members through things like the Silver Sneaker program, right?
Yes, actually, my mom just joined, and she joined a Silver Sneakers program to start exercising, and it's really been helping her. Medicare Advantage is a great example of a way that health insurance providers are innovating to offer those extra benefits to members, whether it be dental, vision, a gym membership, more support for wellness. And that's really overall what insurance providers are investing in, because that keeps people healthy for the long term.
And what happens there is you're getting older, you're on a fixed income in many cases, and you're going to have most of the kinds of medical problems that we have as you get older. So, I mean, the convergence of all of that, it's good that we have companies now trying to meet you at the economic standpoint, but also at the physical standpoint there in terms of your good health.
Absolutely. When 70% of a person's health is non-medical factors, it's critical that we are investing in these programs and really trying to meet people where they are, use case managers, and bring that personalized care to every single one of our members.
I hope people will check out the website. It's ahip.org. That's the American Health Insurance Plans.org. Okay, check it out today. Cathryn, it's been great having you in this morning. Thank you for taking the time to be with us.
Jerry, thank you for having me.